Hello everybody. Myself is Professor Somnath from the Department of Forensic Medicine and Toxicology, and we'll be giving a lecture on electrical injuries. As you know that this is one of the important chapters under injury, and we'll be doing this electrical injury in this audio-visual mode only because of this extraordinary situation where we cannot hold the classes. This is, I think, a very familiar picture for you people, which is a picture of an electrical circuit with one electromotive force generator, that is the cell, and the second one is said to be the load. Whenever a person comes in contact with this electrical circuit, especially an open electrical circuit, the person gets electrocuted. Our discussion on the electrical injuries begin from here. There are usually two forms of current. One is said to be a direct current, very commonly known as a DC. This current is usually seen in the electromotive force generator that is known as a dry cell. It is used very often in our batteries that we use for viewing a television in the remotes, and it is a very simple thing, that is, it's having one circuit with only one generator of electricity. The second type of current, which is known as the alternating current, is commonly used in the household electrical equipments. This current is having an unique feature where we see that there is a change in the direction of the current. It goes down and up. That means it changes in one cycle in two directions. The next thing that we'll be looking into is the different forms of electricity. We can also say it different sources of electricity. And as we have seen that in most of the cases we have three types of sources. The first one we call the domestic source, and it consists of near about 240 volts. The second one is an industrial one where the volt is increased to a huge extent and it can be up to 40,000 volts. The last but not the least is the lightning mode where the volt is infinite. Naturally, you people can understand that whenever a person comes in contact with a live wire in a domestic field, will be electrocuted less severely than that of an industrial one. But the most common causes of electrical injuries are mainly from the domestic equipments. Now we'll be discussing about the factors influencing electrocution. Usually, in most of the cases, we find that whenever we try to remember the factors influencing electrocution, we look into the books of forensic medicine and toxicology and try to remember it by heart. Simple, মুখস্থ করা যাকে বলা যেতে পারে. But the thing is that we can enumerate the different factors very easily by looking at two important laws of electricity. The first one is said to be the Ohm's law. This Ohm's law is depicted by this picture as we have seen. I is equal to V by R, where I is the current strength, V is the voltage, and R being the resistance. The next important law in this section is said to be the Joule's law. This is represented by the formula Q is equal to I square RT. Here Q is the heat generated, I being the current strength, R being the resistance, and T is the time. So we see that whenever current flows through any conductor, it produces heat. And this heat is mostly responsible for causing the electrical injuries. So it explains the basic concept. That is, as we have already stated, conversion of electrical energy to the thermal energy results in all type of injuries in forms of burn. So you people can jolly well understand that though this is a separate chapter on electrical injuries, but the common finding in this type of injury is due to burn. Now let us enumerate the factors influencing electrocution. We are very familiar with these two formulae. One is equal to V is equal to IR, which is the Ohm's law. And the second one is Q is equal to I square RT, that is the Joule's law. So even if we do not read our book and we get a question on the factors influencing electrocution, we can jolly well say the common factors. The first is definitely the voltage. More will be the voltage, more will be the I, that is the current. Naturally, more will be the injury that is produced due to current flow. The second one being the current strength. As we have seen, and also we have explained, that mostly the current strength is directly proportional to the Q, or the heat generated. That means more is the heat generation, more will be the injuries. And in this law, that is the Joule's law, we have very clearly seen that this I, that is the current strength, is squared. That means if we increase this I, that is the current strength, twice, the heat generation will be near about 4 times. Naturally, if we can enumerate all the factors and ask you a question, which is the most important factor influencing electrocution, your answer definitely will be I, because it is squared. The third one, as we can easily understand, is the resistance. As we see here, Q is directly proportional to the resistance. More will be the resistance, more will be the heat generation. Very similarly, time is the next important factor. More will be the time of exposure, more will be the Q generation, that is heat generation, and more devastating will be the injuries. Apart from these 4 factors, there are some other factors that we'll be discussing right now. The fifth one is the current, whether it is an AC current or it is a DC current. We have seen the mechanism of production of injuries due to AC and DC current. We have actually seen the physics of AC and DC current in the second slide that we were dealing with. Here we have seen that AC current is a type of current which changes its direction in every cycle. In a practical experiment, it has been shown that due to this change in the direction, a person coming in contact with a live wire where AC current is flowing, that person gets a tetanic contraction of the muscle, and hence he or she is unable to release that live wire. This causes more injury. And if you people are given a question that which type of current is more dangerous, whether it is AC and DC, I think you have got the answer. Next one is the surface area of contact. It has been found more the surface area, the lesser is the heat production, because when the surface area is more, the heat is dissipated, ছড়িয়ে যায় over a larger surface area. And the heat generation over that area, if it is low, it will cause less injury in that specific area. The next factor is definitely another important compound that is known as the insulators. We know that the insulators are those substances which does not allow the flow of current. So whenever there will be good insulation, the current flow will be restricted and the injury will be lesser. Here is another important factor which is known as the predisposing factors. These factors has to be explained. Predisposing factors means a person might be suffering from an age-old disease which can be exacerbated due to this electrocution. Maybe the person is suffering from a heart disease, he has an ailment as far as his heart conduction is concerned, and if this person gets electrocuted, in all probability it will cause more injury than a person who is not having a heart disease. So predisposing factors are factors which has to be kept in mind while we get patients of electrocution. Now we come to another section to see what are the effects of a current strength. This is very clearly shown in this picture or slide. I would ask you to remember this slide for your MCQs, because I have seen a number of times there are several MCQ that is coming from this specific chart. This chart explains the different type of sensations or effects with the current intensity. The very common question that I have seen is the first one, that is, what happens when there is 1 milliampere current is going? Tingling sensation and almost non-appreciable. There will be another question that I have commonly seen is with this section, that is 16 to 20 milliampere, where we have seen that there are tetany of the skeletal muscles. Next important question, MCQ definitely, comes in the next section, that is the paralysis of the respiratory muscle. It occurs around which milliampere current strength? The answer is 20 to 50 milliampere. Around 100 milliampere there will be ventricular fibrillation. But the most important of all the questions I have seen very frequently asked is what is the current intensity of the asystole, and the answer is 2 ampere. So these are 4 or 5 important chart inputs that has to be kept in your mind for your MCQs. Now we come to the causes of death. We have seen in most of the electrocutions the causes of death are usually 3 types or 4 types, of which the cardiac injury is the commonest one. The next common is the respiratory muscle paralysis, and the third most common is the CNS injury. Apart from these system related injuries, there are other type of causes of death, and it can be accidents. That means a person may not be electrocuted in order to cause the death, but due to the accidents that result due to electrocution, the person may be dead. That means a person while trying to repair a overhead live wire suddenly gets electrocuted. May not be that the current is causing harm, but as he is thrown away from that specific area, the person may get accidents and may die due to other type of injury. It can be a head injury or anything like that. Now we will be discussing about the mechanism of the cardiac injuries caused by electrocution. There are a number of hypotheses why this cardiac injury occurs. The most acceptable one is that, as we have seen that current flow produces heat, this heat degenerates the protein, and most of the nervous impulse is traversed by the nerves which is having a protein sheath, and this protein sheath gets denatured, resulting in a malfunction of the nerve impulses. There is another hypothesis which states that the mini cardiac activity that is already there in the heart gets override by the huge voltage when traversing through the SA node and AV node. That means the smaller amount of electrical current generators are shattered due to the movement of high voltage. This is the second hypothesis. Respiratory muscle paralysis also occurs because of the same reason, and that reason is mostly due to denaturation of the protein. The CNS injury is again for the denaturations. So these are mostly the cause of death in case of electrical injuries. Acute cardiac injury results in ventricular fibrillation, and ventricular fibrillation is the main cause of death in most of the patient. I have separately highlighted this point because this is an important MCQ for you people. As you see here is a picture of ventricular fibrillation. You find that nowhere in this picture you can find the ventricular complex in a very precise manner. This is a typical example of ventricular fibrillation. These V leads are very prominently showing this type of pattern where we do not find any kind of QRS complex. Another important thing that I will try to explain in front of you is the pathway of transmission of current and how it is related with the death of a patient. I will show you three pictures. These are the three pictures, and I think you can understand the direction of the flow of the current that is depicted in red in most of the pictures. This is the red line that is being shown, and from here is the entry point. This is the entry point. In this case, this one is the entry point, and in this case, this one is the entry point. Now I will pause for a few seconds, and you people will try to find out which one is the major organ that is being involved in the first picture, in the second picture, and in the third picture. Okay, let us see the answer. In the first picture, The most common organ that is affected is heart. So most of you are right, because it is traversing through the heart in this direction. In the second one, in most of the cases, this kind of traversing can include heart or exclude heart, but definitely it causes the respiratory muscle paralysis. Here is the third one. The current, if it flows in this direction, is very close to this region of the brain, which is known as, correct, you people have got it right, is the midbrain, pons and medulla. That is the brain stem, where in most of the situations when electricity travels through this area, they shatter the reticular activating system, and the central controlling unit of respiration is deranged. So in the last picture, in most probably again respiratory failure can be the cause. But in first one and also in the second one, the commonest cause will be, correct, heart failure. Now please try to see what is written here. When the pathway of current is vertical and parallel to the axis of the body, it is most dangerous. Please remember, this is again an MCQ. It involves all the vital organs, the central nervous system, heart, respiratory muscle. In pregnant women, it can result in expulsion of the fetus also. The second one is the horizontal pathway from hand to hand, and the commonest one involvement is heart, but it can also involve the respiratory muscle and the spinal cord. Pathway through the lower part of the body usually causes local damage. So this is a good one if it happens so through the lower part of the body. Please remember, in the autopsy finding, we will be dealing with the injuries that is produced due to electrical flow. There is a dictum, as we say, that most of us try to get passed in an examination taking a simple shortcut. That is, we may not buy our textbook, we can go for a chotha and try to get a pass mark. The current is just like that. After entering into the body, it takes a easy pathway through which it can travel. That means when current enters into the body, it tries to find out a pathway of least resistance. And what can be that? Yes, those people who thought it is blood is the right answer. That is, when current enters into the body, it tries to follow that path of least resistance, that is, through the blood it travels. And when it travels in that way, naturally, if we just remember the Joule's equation, where heat generation was directly proportional to I square RT, we can easily see that if R is 0, the heat production will be 0. Naturally, the injury due to heat inside the body due to the transmission of current will be very less. So, where will be the most of the injuries located? Most of the injuries will be located at the point of higher resistance. This higher resistance is offered by the skin. Skin out of most of the organs give a very high resistance to the current flow. Naturally, all the injuries are limited to the skin as far as electrical flow injuries are concerned. Here we have tried to give you an idea of the injuries that we try to find in an autopsy in a suspected case of electrocution. So this is the line: tissue damage results due to heat generation. We have already explained. Current traverses through the shortest distance and the path of least resistance. We have already explained this thing also. Maximum resistance is offered by the skin, bones and the fat, and the least by the blood. So the initial hypothesis that we had discussed very clearly finds out all the three important points that I right now have told. Please remember, bone is the substance that gives the maximum resistance. After that, it is the skin in the body. It is an MCQ for you people. Maximum features of electrical injury, hence, is seen over the skin and least is inside the body. I think you people have understood why this happens. খুব সহজভাবে বলতে গেলে, যে কারেন্ট স্ট্রেংথ শরীরের ভেতরে ঢুকলো, সে যখন ব্লাডের মধ্য থেকে যায় তখন হিট প্রোডাকশন প্রায় শূন্য। তার কারণ হচ্ছে ব্লাডের কোনো রেজিস্ট্যান্স নেই, বিকজ ইট ইজ মোস্টলি মেড আপ অফ ওয়াটার। যেহেতু হিট প্রোডাকশন নেই, সেহেতু হিট প্রোডাকশনের জন্য যে টিস্যু ড্যামেজ সেটাও হবে না। তাই এই টিস্যু ড্যামেজ ইজ ইউজুয়ালি কনসেন্ট্রেটেড ওভার দ্য এরিয়া যেখানে হায়ার রেজিস্ট্যান্স আছে, যেরকম স্কিন। আমরা যত ধরনের অটোপসি ফাইন্ডিং দেখব, সেই অটোপসি ফাইন্ডিংটা কিন্তু সাধারণতভাবে স্কিনের ভেতরেই সীমাবদ্ধ। Now, this burn injury, which is actually an electrical burn injury, যদিও উপরে লেখা আছে burn injury, but please read it as an electrical burn injury, is classified into two groups. একটা দেখাই যাচ্ছে, this is an endogenous burn, and the second one is an exogenous burn. The word endogenous means which is generated from within, and exogenous means which is generated from outside. So let us discuss about the endogenous burn. This is how it looks like. If you can see here, this is an area which is known as a crater, and after that there is an area of devitalized tissue, and after that there will be an area of a slight hipped up keratin, and beyond that will be a zone of redness. This picture is not so good, but I think you can get a very good picture in your books, textbooks, and this will help you to identify how this endogenous burn looks like. This is the depiction of an entry wound. This is the depiction of an exit wound. If you can see, the pattern of this is more or less the same. At the center there is an area of necrotic tissue which is black in nature. The rest of the area is usually burnt. There will be an hipped up area at the periphery, and beyond that will be an area of redness. Now the simple thing is, whenever electricity enters into the body, it creates heat. This heat results in this charring of the tissue at the center. The surrounding area, which is actually formed of different keratin material, this keratin material is melted, and this molten keratin material is pushed aside, and whenever they are pushed aside, they creates an heaped up area at the periphery, and beyond that heaped up area there is a redness or a zone of redness, which is nothing but the signs of inflammation or the vital reaction. So this is how the exit wound look like, but both the entry and the exit wound, the picture and the features are almost the same. When we go for an histopathological examination of that area, we have seen that this keratinized layer, in the keratinized layer, all the cells are having an elongated nuclei. As I have told, that this melting and the current flow, they changes the normal architecture of these nucleus and they form elongated. Now we come to the discussion of the exogenous burn. They are mostly of different types. The first one being the electrical arcs. The second one is the flame burn. The third one is the flash burn. Before we go into the detailed discussion of this exogenous burn, I would like to tell you one thing. Why the previous burn, which is also known as a Jules burn, was called an endogenous burn and not an exogenous one. I will wait for a few seconds for you to think over this matter. I think some of you got it right. The reason is nothing but the heat that is generated due to the electrical current is due to mostly by the resistance offered by the skin. And since skin is a part of the human body and that skin is resulting for the heat generation due to its high resistance, it is known as an endogenous burn. A substance that is endogenous to a human body, that is skin, is responsible for the changes that results due to the electrical flow. That is the reason behind this type of burn injury, and hence it is known as the endogenous burn. Now we come to the discussion, as we see here, about the exogenous burn. We have seen that they are of three types. One is the electrical arcs, the second one is the flame, the third one is the flash burn. Let us discuss something about this electrical arc. This is how it looks like. Have you ever seen when two live wires are very close to one another? We bring one live wire close to the other, not connecting them. What happens? We have seen some spark coming from one end of the live wire and going to the other end. These are the electrical arcs. Do you know why this spark usually seen? They are nothing but heated electricity. They are nothing but heated gases. whenever the live wires are coming near to one another, the gases in between the two live wires become the conductor. And when these conductors conduct the electricity, due to the same reason of heat generation, most of the combustible gases like oxygen, hydrogen, they get ignited and result in the spark. Naturally, this heated gas results in different type of injuries like this one. A current sparks are formed between the objects of different electrical potential that are not in direct contact with each other. Most often, a highly charged source and a ground. The temperature of this electrical arc can reach around 2500 to 5000 degrees Celsius. So this is a type of injury mostly because of high temperature. The second type of exogenous burn is the flame burn. This is because of the ignition of the clothing, and the cause of ignition is nothing but the heat that is produced, which has been explained in earlier discussion. Whenever this ignition occurs, especially of the clothing, the person gets flame burn. This flame burn is identical with the dry heat burn that we have already discussed in our previous class on burn injury. Both electrothermal and arcing currents can ignite the clothing. The last one of the exogenous burn is known as the flash burn. Please see here, a flash injury may not be traversing through the body of the individual. The flash injury may traverse from a high voltage to a low voltage region, and currenting arcs produces huge heat, and that heat hits up the gaseous particles surrounding the arc and ultimately result in the burn injury. When heat from a nearby electrical arc causes thermal burns, but current does not actually enter the body. In the previous one, in the flame burn, the cause of death was definitely flame, but there the current had entered into the body, but here it does not enter, and this is a flash burn. Flash burns may cover a large surface area of the body, but they are usually only partial thickness, as we have seen the different classifications of burn injury in our burn class. Now in this context, I would ask you to remember one terminology known as crocodile skin that is often given in your short note. In this context, I would ask to remember another important thing, that all these flash burn or flame burn, they causes burn injury over the body identical with the burn that we have read due to flame or dry heat in our burn classes. So how to differentiate it, whether it is a burn injury caused by electricity or dry heat? The simple thing is, in most of the cases of electrical burn injury, we get some molten materials over the skin, and that molten material is nothing but source is coming from the molten metals of the different live wires. It can be a copper, it can be something else, but these copper deposition can be identified over the dead body of the person. So this is the way we differentiate. So I think it is more or less clear up to this much of today's discussion. Today's discussion, we have seen that what is the mechanism of formation of different type of electrical injuries, what are the different types, what are the causes of death, what is exogenous and endogenous burn. So let us stop our discussion for today. We'll be taking next class very soon on the most remarkable part of forensic medicine and toxicology, that is toxicology. I would ask the students to read this chapter and keep prepared the short notes as we have already told you, like that of endogenous burn or that of crocodile skin, and please do read a terminology which is known as filigree burn in response to lightning injury. This I'll be try to discuss with you if I get time in the following classes, but please be prepared with all the short questions and the MCQs. Good luck. And thank you very much for your patient hearing. We'll be trying to take a doubt clearing session either by any mobile app or through email. We'll try to do it in next few days and let you people know.